A lot of women are wearing red today, as you can see, for National Wear Red Day. It's intended to draw attention to the #1 killer of women, heart disease. And joining us now is Dr. Gurpinder, who oversees the new Women's Heart Health at Women and Babies Hospital in Lancaster. Thanks for being here.
Thank you, Susan.
Dr. Chadha, we often hear that women don't recognize the symptoms of heart disease. What are some of those symptoms?
Well, it's difficult for women sometimes to recognize the symptoms of heart disease because the symptoms can be very subtle. And unlike men, 40 to 50% of women might not have any chest pain. The symptoms can include shortness of breath, lightheadedness, severe fatigue, or flu-like symptoms. Anything that's new or unusual can be important.
We're still saying that heart disease is the number one killer of women. What kinds of headway have we made in that area?
Well, in the last 10 years since the Go Red first started, there has been an improvement. About 20% less women are dying of heart disease. There's 20% more increased awareness. But I think we're still not where we need to be. We still have a long way to go because 40 to 50% of women still do not look at heart disease as the leading cause. And even when they do know the facts, they don't always take it personally. They still don't think that it can happen to them.
And quickly, what's your best advice for women to avoid heart disease and if they think they are having symptoms?
Well, I think the most important thing to remember is that we're all at risk. You know, some women have a higher risk than others, but no one is immune to heart disease. But I think the most important thing to remember would be that studies have shown that 80% of heart disease is preventable. So even though we're all at risk, we can all do something to prevent it.
Those lifestyle things. Thank you so much for joining us, Dr. Chadha, on this Go Red for Women Day. Thanks.